Hello and welcome. Today we're diving into a rare but fascinating topic, amyloidosis of the conjunctiva. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. So, let's get started. So, what exactly causes this condition? Amyloidosis, in general, is characterized by the abnormal deposition of amyloid proteins in various tissues and organs throughout the body. In the case of the conjunctiva, these amyloid deposits can be either localized, meaning they only affect the conjunctiva itself, or systemic, indicating the amyloid deposits are part of a broader systemic disease affecting other organs. While the exact etiology is complex and not fully understood, genetics, chronic inflammation, and certain medical conditions can increase the risk. In some cases, no underlying cause can be identified. This is termed primary amyloidosis. Now, let's talk about the how. Pathophysiologically, the abnormal deposition of amyloid proteins in the conjunctiva disrupts its normal structure and function. These deposits, composed of misfolded proteins, accumulate in the subepithelial layers, the connective tissue beneath the conjunctival surface. This accumulation can lead to thickening of the conjunctiva, vascular compromise, and ultimately, the clinical signs and symptoms we'll discuss later. The body's inflammatory response to these deposits can further exacerbate the problem. Amyloidosis of the conjunctiva is considered a relatively rare condition. Because it's often underdiagnosed or misdiagnosed, it is difficult to assess the exact prevalence. It can affect individuals of all ages and ethnic backgrounds, but some studies suggest a slightly higher prevalence in older adults. The occurrence of conjunctival amyloidosis in conjunction with systemic amyloidosis is not extremely common, emphasizing that it can present as an isolated finding. So, how does amyloidosis of the conjunctiva present itself? Individuals with conjunctival amyloidosis may experience a range of signs and symptoms. These can include redness and irritation of the eye. Often, patients will complain of a gritty or foreign body sensation. You might also notice visible, yellowish or waxy deposits on the conjunctiva. In more advanced cases, the conjunctiva can become thickened and nodular. In severe cases, vision can be affected if the deposits cause significant corneal involvement or eyelid malposition. Diagnosing conjunctival amyloidosis involves a thorough ophthalmological examination. The doctor will carefully assess your eyes and eyelids, looking for characteristic amyloid deposits. A crucial step is a conjunctival biopsy, where a small tissue sample is taken and examined under a microscope. Special staining techniques, such as Congo red staining, are used to confirm the presence of amyloid deposits. Further systemic evaluation may be needed to rule out the presence of systemic amyloidosis. This can involve blood tests, urine tests, and potentially biopsies from other organs. While there are not necessarily types of conjunctival amyloidosis in the same way we categorize other diseases, it's important to distinguish between localized and systemic presentations. Localized conjunctival amyloidosis only affects the conjunctiva, while systemic amyloidosis involves multiple organs. The distinction is crucial because it affects the overall management and prognosis. It's also worth noting that the specific type of amyloid protein involved, e.g., AL-A-TTRA, can vary, especially in systemic cases, and can influence treatment strategies. Currently, there's no cure for amyloidosis, so treatment focuses on managing symptoms and preventing further progression. If the amyloidosis is localized, surgical excision of the deposits may be an option. However, recurrence is possible. Topical lubricants and anti-inflammatory eye drops can help alleviate symptoms like dryness and irritation. If systemic amyloidosis is present, treatment is directed at the underlying systemic disease and may involve chemotherapy or other systemic therapies. Close monitoring is essential to detect and manage any complications. Unfortunately, given that the exact causes of amyloidosis are not fully understood, primary prevention of conjunctival amyloidosis is challenging. However, managing any underlying inflammatory conditions and maintaining a healthy lifestyle might contribute to reducing the risk. If systemic amyloidosis is present, adhering to prescribed treatments and monitoring can help prevent the development or worsening of conjunctival involvement. The prognosis for conjunctival amyloidosis varies depending on whether it's localized or systemic. Localized conjunctival amyloidosis generally has a good prognosis, but recurrence after surgical excision is not uncommon. Systemic amyloidosis can have a more guarded prognosis, depending on the extent of organ involvement and the response to treatment. Recent research is focused on developing new therapies that target the amyloid protein itself, aiming to prevent its deposition and promote its clearance. These advancements offer hope for improved outcomes for patients with both localized and systemic amyloidosis.